Hello and welcome to Northern Arizona University's Biology 201 Lab and 202 Lab. This is a safety video, and today we're going to go over some important information. Whether you're in Biology 201 or 202, safety is our #1 priority. Please pay close attention, take notes, and refer back to this video throughout the semester. We will be going over how to use lab equipment safely. We will have some chemicals and different kinds of sharps to be aware of. We will also talk about how to properly dispose of sharps. Then we'll discuss safe practices for handling biological specimens. Then we'll talk about how to clean up after dissection, and lastly, what to do in case of an emergency. Our anatomy labs include dissection of preserved specimens. You must wear the correct personal protective equipment, which includes gloves and safety goggles. We also recommend a lab coat, but it is optional. After dissections, wipe down your goggles with ethanol and a paper towel, then place them in the UV sterilizer. Gloves can go in the normal trash, and it is always good lab etiquette to wash your hands before you leave. Some hazards you may encounter in class include scalpels, sutures, different phlebotomy instruments, and broken slides. There are also chemicals you need to be aware of, like ethanol. We use ethanol in the lab for cleaning, and then there's Carroll's Perfect Solution, which is what is used to preserve the sheep kidneys you might dissect or other specimens. Over here, you can see there are 3 different kinds of scalpels that we use. This scalpel, you have to push this part in to unlatch the cover, and then the cover slides down and then locks in place there. So don't just push down with your hand. You have to unlatch it right here. This scalpel here has a cap, and if you're taking the cap off, you do not have to recap this scalpel, so you can just throw away that part. And then this scalpel has a retractor or extender right here, and so it's kind of like a box cutter, so you have to be careful where you extend it or not, because it comes out of this top here. Here are some phlebotomy instruments used for doing blood draws or other phlebotomy things. Here we have a broken slide, and this is glass, so it's going to go in the broken glass disposal, which I'll show you later. And then this is a suture. The suture has string attached to it here, and it has a very sharp point. And all the sharps here, except for the slide, go into sharps disposal. The 70% ethanol is flammable, and it can be irritating to your eyes and skin, so try not to expose yourself too often. And the Carroll Safe solution is not incredibly toxic. You can get it on your skin. You do have to wash your hands afterwards. And if you're wearing gloves and safety glasses, you shouldn't get any in your eyes or ingest any. Those are the things you don't want to do with this stuff, but it can go down the sink, and it is very mild compared to some other preservatives. There are a few ways to dispose of sharps, and for scalpels, needles, and other metal sharps, you will be using these red biohazard containers. You just drop them in, and they are disposed of. This is a different type of biohazard container for sharps, where there's a little lever here, kind of like a mailbox, and you just drop in your scalpel there, and they get locked away. You don't have to dispose of every scalpel right away after you use it. We can reuse them a couple of times, but if you notice yours is very dull or if it's broken, go ahead and dispose of it. The needles will also go in there, and sutures will go in there. Broken glass has its own container. So in your classroom, you'll see these cardboard bins labeled disposal for broken glass. And I highly recommend you tell your TA when you have a broken slide so they can handle all the broken glass. And then your TA can get you a new slide. You will do many dissections in this class, and it's very important that you use proper technique. We do not want you to accidentally cut yourself. Good technique involves cutting away from your hand. So you can see here, this is an avocado, but in class it might be an eyeball or a heart or a kidney. And so you want to cut away from yourself, so there is no chance of you accidentally cutting yourself. And obviously you can see here, bad technique. This person was holding the avocado and, well, they cut right through the avocado and into their hand. So we don't want you to accidentally cut yourself. Don't cut toward your hands. It's very easy to accidentally slip and cut all 5 digits off. If you do ever accidentally cut yourself, let your TA know immediately, and they can direct you to the first aid kit or to campus health for resources and medical attention. So after completing a dissection, you will have to dispose of the specimens using these red bins. They are located on the back wall of class, and there is a sign above it labeled animal parts or specimens. It might be different in the 201 room, but these biohazard bins have a nice big biohazard sign, and you can step on them, and there is a red bag. Only specimens go in the red bin. You don't need to put gloves, and you especially should not put sharps in this bin. Gloves can go in the normal trash. Things can happen, and some specimens may have some pressure in them. And when you go to cut, and if you're not wearing your safety glasses, you may get some specimen juice in your eye. So to counter that, we have an eye wash station in room 125. This is Bio 201, and if you need access, you can go through this door, and in the back corner here is where the eye wash station. If you're in Bio 202, this is your lab space, and your eye wash station is in this back corner. The eye wash station can be quite easy to use. You just pull it out of its socket there, and then you can pull the handle, and it will spray water. If you actually have exposure in your eyes, you can use that right away. Don't worry about making a mess. If you have cuts or laceration, here is our first aid kit. They're at the front of class, and you can tell your TA that you need some first aid, and they can get some supplies out here for you. During dissections, you may start to feel lightheaded or ill, and that is a good thing to tell your TA. You may want to take a break, and if you feel dizzy, you can just sit on the floor. We don't want you to pass out and hit your head on the floor, so sitting down makes it a little safer. If you feel any other type of illness, then let your TA know. If you haven't come to class already, you can send them an email, and you can ask to be excused from class. Always refer to the syllabus for what to do if you can't make it to class. If there is a medical emergency during class, let your TA know so they can activate Emergency Medical Services, or EMS. Some medical emergencies can include student losing consciousness, serious uncontrolled bleeding, seizures, or allergic reactions that can cause respiratory distress or arrest. Class may be paused or canceled depending on the seriousness of the medical emergency, and your TA will let you know what to do until the medical emergency has been taken care of. Other emergencies can be caused by fires or really if the classroom becomes unsafe. Please follow your TA and exit the building. There are exits to the left and right after you leave the classroom. So if you're looking at Bio 201, this is your main door that you come out of, and there's an exit over here, or if you go left after exiting the classroom, there is an exit through here. Same for Bio 202, you can exit through the main door and go through here to exit the building. Thank you so much for your time, and I hope you have a wonderful and safe semester.